Hello, my name is Emma Gregory and I'm an occupational therapist at Salisbury District Hospital. I'm going to be talking to you about managing cancer-related fatigue. And there are several learning goals for this session. The first one, I'm going to be talking about what is cancer-related fatigue. I'm then going to go on to talk about why you may be experiencing it. And I'm then going to explain symptoms of cancer-related fatigue. I'm going to use two diagrams to help you understand how this works, the boom and bust cycle and also an energy battery. And I'm then going to go on to talk about 6 Ps, which are different ways of helping you manage your cancer-related fatigue. These are pacing, planning, prioritizing, posture, problem solving, and giving yourself permission. I'm going to talk about energy conservation, and I'm going to go through different activities of daily living, daily tasks, with some ideas and some strategies to help you manage these within your cancer-related fatigue. And I'm then going to touch briefly on the importance of physical activity and sleep. And at the end of this session, I'm going to give you some resources if you would like to find out more information and more support. So firstly, what is cancer-related fatigue? And for many of you, you will know that this is different from normal fatigue or tiredness, where you feel better after you stop and rest. Unfortunately, it doesn't go away even after you've had a rest or even sleep. And unfortunately, it can go on for months or even years after your cancer treatment. And fatigue, as you know, can affect all areas of your life. And these are some statements made by patients I've worked with who are experiencing cancer-related fatigue. Someone has said, I feel like someone let the plug out somewhere and all my energy drained out. It's in the limbs, but also in the head. I feel listless to read a newspaper or watch television. I feel total tiredness. I wake up and I think I've got nothing out of this sleep at all, and it's so bad that I know I'm hungry, but I'm too tired to get up and go and fix it. And if I fix it, I'm too tired when I sit back down to eat. And again, you might want to write your own statement about how cancer-related fatigue is affecting you and personalising it to your experience. But to reassure you, I hope one of these quotes touches you and reassures you that what you are experiencing is normal. And you may be wondering, why am I experiencing this fatigue? So there are many, many reasons. And the first is your treatment for cancer, chemotherapy, radiotherapy, hormonal therapy, or targeted therapies, or even the surgery that you have had. All of these can contribute to that feeling of complete fatigue. You may have low levels of red blood cells. This is known as anemia. And again, this can contribute to that feeling of complete fatigue. And you may also be experiencing eating problems. As we know, your cancer treatment can affect your appetite and your taste. So this may mean you're not getting enough energy from your food. You may be experiencing pain, which is exhausting. And you may have other symptoms like fluid retention, infection, temperature, or feeling breathless, which all contribute. You may be experiencing sleep disturbance, and you may also be having night sweats as a result of your chemotherapy. And importantly, due to your fatigue, you will be feeling less like managing activity, and you may be experiencing a loss of fitness. And you may also have other health problems like heart problems, diabetes. You may be struggling with overweight, and also problems with your lungs, your breathlessness, and your mood may also be affected by your cancer. And so all of these causes contribute to your experience of cancer-related fatigue. Here are a range of symptoms you may be experiencing, and you may wish to make a list of your own. Some people find it hard to do routine tasks. Some have problems with their sleeping. You may be experiencing difficulty remembering things, or you may have pain in your muscles. You may be feeling dizzy or lightheaded, and you may have trouble thinking, speaking, and making decisions. You may be finding it hard to concentrate or lacking motivation, and you may have a loss of interest in things you normally enjoy. And again, it may be useful for you to make a list of how fatigued your symptoms are, because again, that increases your awareness and it helps you learn to manage them in your everyday life. This is known as the boom and bust cycle, and it's really helpful when we're trying to learn to manage our fatigue. And what you may have experienced is a day when you're feeling you've got a lot of energy, and then what you do is you try and manage and complete as many activities as you can on a good day. And you can see from this diagram that on a good day, your level of activity will increase, which is the boom beginning of the diagram. And then unfortunately what happens is you then on a bad day, the following day, because you've tried to do too much, you really struggle and you feel as if the energy has been completely taken away from you. And if you get into this cycle of trying to do too much and then the next day really struggling, it becomes this boom and bust cycle. And what we're trying to do through managing our fatigue with the techniques I'm going to show you soon is to get into more of a plateau where you're doing a bit of activity and then rest, bit of activity, then rest. So it's getting to know what activity works for you, because we're all very different, and what works for one person will not necessarily work for the next person. So what we're trying to avoid is that boom and bust. And it's helpful to keep that in your mind when you're planning activities each day. This next slide, known as the energy battery, is also really useful. And if you imagine each time you wake up in the morning, you have had sleep and your battery will be fully charged. It's also useful to think about this similar to your mobile phone. When you put it on charge, you know that you have different chips that are building up to create a full charge. So if you imagine when you wake in the morning and your battery is fully charged, what you're then doing during your day is choosing activities that are important to you. And for each of those activities, a bit of that energy and a bit of that battery will be taken away. By resting, you will then be recharging your battery incrementally during the day. So what it's about is managing your battery effectively by using the strategies we're going to talk about next, which are known as the 6 Ps, and avoiding using all your energy, as in the boom and bust cycle, and completely depleting your battery and then leaving no energy left for you to then carry on with other tasks. So, how can you manage your cancer-related fatigue? These strategies are known as the 6 Ps: prioritising, pacing, planning, posture, problem solving, and permission. And I'm now going to go through each one in turn and give you ideas on how you can use these 6 Ps to manage your cancer-related fatigue from day to day. So the first strategy is prioritising. And this is about choosing to use your energy for what is important to you. So this involves asking yourself, is this activity important to me? How much of my battery will it use? How long will it take? Do I need to do it? Could I do it less often? And is there anyone else who could do it? Could the task be delayed? And are you prioritising enjoyable activities? And also importantly, are you prioritising physical activity? And it's useful here to think about that energy battery and to think about each day, what do I need to prioritise? Is there someone else that could do one of these tasks for me so I can conserve some of my energy for an activity that I would enjoy more? And do I need to do it? Prioritising is a skill. It takes time to develop it, but it can be a useful way of managing activity each day. The second P is pacing. And this is about managing activities, as we've talked about, avoiding that boom and bust cycle and making sure you're pacing the rate of activity during your day. And you can ask yourselves questions. Can you achieve this amount on a bad day? Are you being realistic with what you're asking yourself to achieve? And can you achieve your goal little and often? Can I put in regular rest periods between activities? So a 10-minute break each hour can help fatigue and it can re-energize you. And also importantly, it's about pacing and learning to get to know yourself so you're able to stop and rest before getting tired. The next P is planning. And this is about breaking tasks down into smaller chunks. For example, if you need to mow the lawn, it's about mowing the lawn in sections. If you need to vacuum, it's about doing one room at a time and resting in between or spreading that out across the week. And if you are going for a walk, it's about making sure there's a bench or a cafe you can take a rest in rather than trying to do it all at once. It's about planning in some downtime, some rest, and breaks in between your activities. And 10-minute breaks each hour is a good way of making sure you're planning and resting in between tasks. Planning activities for when you have more energy, but avoiding that boom and bust cycle. And a fatigue diary can really help identify these times. And it can be useful for you to begin to identify which times in the day you feel naturally, with your own body rhythm, you have more energy. And then you can plan activities within those times that make sure you're having a rest for 10 minutes every hour after you've completed a task. This can lead to developing a weekly schedule, and by concentrating on one activity at a time, the planning can help you avoid that boom and bust. It's avoiding doing all the tiring activities in one go and making sure you plan one thing you enjoy and some relaxation each day. Posture is really important too. And having a good posture conserves energy by avoiding strains. Making sure you change your positions frequently can avoid fatigue. And sitting rather than standing. Adjusting the height of chairs, your desk, computer can all help conserve energy. And avoiding too much bending. So if you are bending, bend with your legs, not your back. And again then, good posture is helping you conserve energy. And it's also about placing most frequent items used within easy reach. So again, you're avoiding all the bending and the stretching, which takes a lot of energy, and you're using your posture effectively to complete the tasks that you would like to. Problem solving is our next P. And this is about learning and asking yourself, is there an easier way to do a task? Is there any equipment or devices that can make this task easier and less effortful? And is there anything I can buy to make tasks easier? For example, if you're cooking, buying pre-grated cheese and pre-chopped vegetables, which again are helping you still complete the cooking, but you are using and problem solving different techniques and different items to make the task more achievable, more manageable, and within your energy conservation. And finally, this last P, permission, is really, really important. And this is about being kind to yourself. It's about allowing for bad days. And it's about not trying to cram everything into your good days, as we talked about with that boom and bust cycle. And it's also, most importantly, asking yourself, what allowances would I make for a friend? Instead of I must and I should, try to replace the language with words like I would like to and I choose to, which give you permission to be kind to yourself and to really learn to listen to your body and manage what you can and avoid doing too much, which will then contribute to your cancer-related fatigue. And these 6 Ps, each one in turn, take practice, they take time, but by beginning to incorporate them into your daily life, this will give you more control and will help you manage your cancer-related fatigue from day to day. I'm going to talk now about energy conservation. And firstly, what is it? This is about looking at everyday activities and seeing if there is a way of doing them which uses less energy. We've already touched on the different strategies that can help you conserve energy, and we've also talked a little about devices or equipment that can support you. And I'm going to talk now about day-to-day tasks which can be more difficult due to fatigue. And I'm going to go through each task and give you some ideas on how to manage these with strategies to help you manage your cancer-related fatigue. So examples of day-to-day tasks which can be more difficult due to fatigue are preparing meals and washing up, shopping, laundry, leisure, hobbies and childcare, work and driving, housework and gardening. And what you may choose to do is to write a list of the activities you find really difficult or your cancer-related fatigue affects you more with. And as I go through the next slides, please write down a few of the strategies and ideas which will help you manage these tasks from day to day. So, washing and dressing. Here are some ideas to help you manage these tasks and conserve your energy at the same time. So, ideas for this include lay your clothes out the night before, have a bath or sit down in the shower, sit down when you're getting dressed, which avoids all the energy that you use in standing and focusing on keeping your balance. Use a toweling robe to dry yourself off after you've had a bath or a shower, which avoids all the effort that you need to use to dry yourself with a towel. Wear clothes that are easy to put on and take off, and for example, clothing with Velcro or elasticated clothing is really useful for this. And there are aids to help you also, like a long-handled helping hand or a sponge, which help you be able to wash your back or your lower legs and conserve energy at the same time. There is equipment to support you, and many people find these gadgets really, really useful because they do make the task more efficiently achieved, and also it means you're conserving energy while still completing the activity. And you can see in this picture there are a few ideas. So for example, an electric tin opener, you can see a garlic press, there is also a plastic jar opener, and then in terms of cooking there is a slow cooker, there's also an air fryer, and also you can think about buying pre-prepared vegetables that are frozen and using them and steaming them. And by batch cooking, keeping food then in containers which you then freeze, when you feel you've got the energy to do that, means you've then got ready prepared meals which you can defrost and eat rather than needing to do that on a daily basis. Housework can be a real challenge, and here are some ideas for managing this more effectively. Spread tasks out over the week. Make a weekly plan and do one job a day. Do a little bit each day rather than all in one go. Clean one room at a time and sit down to do chores when you can, which will help conserve energy. Use long-handled dusters, mops and dustpans where possible. Again, you're then using your posture effectively and avoiding all the bending and stretching that these tasks can involve. Ask someone to take the rubbish out for you. And if you can afford it, think about getting a cleaner or a gardener who who can complete the heavier tasks so that you've got support and help for housework and gardening. Laundry ideas include: use a trolley to move laundry, if possible, rather than lifting heavy loads. Ask people to do their own washing and ironing if possible, or delegate tasks by asking for help to hang out the washing and for changing sheets. Do a small amount of washing and ironing each day rather than trying to do it all at once. Use a lightweight iron. Sit down to iron and hang clothes on a dryer. And use non-iron clothes, which means you're removing the need for ironing at all. With meal preparation and washing up, try cooking simpler meals or having convenience meals. Gather all your ingredients and utensils before starting, or ask someone else to do that for you so you can actually enjoy preparing the food and cooking the activity yourself. You can buy pre-chopped frozen or fresh vegetables or microwave vegetables. Try eating little and often, which takes away the need to keep preparing a large meal and then also having a huge amount of washing up afterwards. Prepare extra dishes or double portions and freeze them when you're feeling less tired. And sit while preparing meals. Avoid lifting heavy items. You can buy lightweight cookware, cooking baskets or serving spoons with holes or steam cooked vegetables. And let your dishes soak in the sink or use a dishwasher, which then removes the need to do that task yourself. Ideas for shopping. This is where planning comes in, so plan ahead, make a list, and make sure the list follows the layout of the store. Shop at less busy times if possible. Use internet shopping and home deliveries. And shop with someone else so they can put things in the trolley, they can do the bending and the reaching for you. And use a wheeled shopping bag or a trolley to help you. And also, if you can, consider a meal delivery service, which could be for a couple of times a week, just to take away that constant pressure of shopping and planning for meals the week ahead. Leisure and hobbies are really, really important. And it's really important that you are choosing and making time for activities that give you enjoyment and are important to you. So making time for hobbies is really important, and you can use your planning and your prioritising, 2 of the 6 Ps, to make sure you're managing at least one activity each day that you do enjoy. And adapt hobbies or break them down into more manageable chunks. Listen to audiobooks if you feel too tired to read. Many describe their concentration is affected by their cancer-related fatigue. Or read in smaller chunks. So, for example, read a couple of pages at a time and then take a break. If you enjoy drawing, try using colouring in books, which is also a lovely mindful way to spend time. And you can listen to relaxing music, do yoga, massage, aromatherapy. Again, if these are activities you enjoy, plan them into your week and making sure you then have a rest afterwards to balance activity and rest. Importantly, please do hobbies that mean something to you, as this does distract you from your fatigue, but also it gives you meaning in your day-to-day life. And importantly, explain to friends or family that there may be times due to your fatigue that you just don't have the energy to see them, and that short phone calls are better and short visits are also better for you. And you may consider setting up a WhatsApp group amongst your family and then another one for your friends, so that you're then updating them on a regular basis without having to constantly repeat information to different people, which again can lend itself to you feeling completely overwhelmed and exhausted. So those are some ideas and some strategies for managing daily activities of daily living. I'm now going to touch on the importance of physical activity. And firstly, what is this? This is about movement of the body that uses energy. And this will mean different things to different people. And examples of physical activity are here listed on the screen. And these involve walking, jogging, climbing the stairs, dancing, yoga, Pilates, swimming, gardening, housework and cleaning. And at this point you may want to make a little list of what's important to you and which activities, what physical activities you are actually achieving currently, and there may be something else that you're keen to take on or try. But most importantly, we know that research studies show that physical activity does reduce fatigue from cancer. So there is a lot of evidence that says physical activity does reduce fatigue. We know that physical activity is really good for our mind and our body, and we know that physical activity can help us sleep better and reduces stress. So it's really important to also think when you are planning your week and you're thinking about managing your cancer-related fatigue, it's important to notice that you are walking, you are managing the stairs, that you are getting out into the garden, for example. And physical activity, as I've said, means different things to different people, but it's important to know that being active really can help with your cancer-related fatigue. And doing any physical activity, even a little, can help manage fatigue. And too much exercise, we know, can make you feel tired, but too little, as we also know, can make you feel more fatigued. So it's about finding your own level, and it's importantly finding activity that you enjoy. And it's also about getting a balance between being active and also getting rest. So with exercise and physical activity, here are a few top tips to take away. Some exercise is always better than no exercise. Set yourself achievable goals. This is really important because if you feel you're not managing your activity, you will feel despondent and it's unlikely you will try it again. So try and set yourself a goal that you know you can achieve firstly and then build on that goal. Gradually increase the amount of physical activity that you do and congratulate yourself for being able to do it. Consider a group exercise programme, walking with others, as many people enjoy the social side of physical activity, and again the support you can get from a group really can increase your motivation to keep going. Most importantly, choose and do exercise that you enjoy. And if exercise is impossible, try to stay active in your daily routine, and this can be through activities like laundry, housework, gardening. All of these activities mean you are staying physically active, which really can help with your fatigue. Drink lots of fluids before, during and after exercise, and really importantly, do not exercise if you feel unwell, are in pain or have other symptoms that worry you. In this Managing Cancer-Related Fatigue session, we have covered a lot of topics. And on this slide, there is a summary and key takeaways for you to remember and use in your everyday life. We've talked about what is cancer-related fatigue, and we've also looked at why you may be experiencing cancer-related fatigue. We've looked at what those symptoms can look like, and you've begun to make a list of the symptoms and the way that cancer-related fatigue is affecting you. And we've also talked about the boom and bust cycle and the energy battery to help you understand fatigue more and be able to relate that to your own experience of understanding your fatigue. We've talked about the 6 Ps, which are 6 ways or strategies for managing your cancer-related fatigue. And we've talked about energy conservation and how to manage day-to-day tasks with different ideas and strategies to help you remain active and physically engaged in daily activities of daily living. And we've talked about the importance of physical activity. And also, we need to remember that sleep and rest is very, very important. And we also know that balancing activity with rest will help you manage your fatigue and will avoid that experience of boom and bust. Here I've listed some resources if you would like more information. The Macmillan website is excellent, and as we know, they are a leading cancer charity and they have a wealth of information and educational tools. So if you would like more information, do visit the Macmillan website. And there is an excellent booklet available from Macmillan on coping with fatigue, which you can order or you can look at on the website. Ruth's story is a patient describing her experience of fatigue after her cancer treatment, and that's available on YouTube. And again, if you'd like to understand more about the experience of cancer-related fatigue from a patient's perspective, please do have a look. I've touched a bit on equipment that is available and devices to support you still being able to achieve the activities of daily living that are important to you and that you need to do from day to day. And there is a variety of equipment providers, and they are available locally and nationally should you wish to look into purchasing any equipment that can support you from day to day. And the Royal College of Occupational Therapy also has an excellent information resource on how to manage your energy levels. And again, you can access that on the internet. Thank you for listening. If you are receiving your cancer treatment at Salisbury District Hospital and have any further questions, please do contact your cancer support worker on 01722 336262 extension 2417. You can access more information on Salisbury's cancer services at the link here on the screen, and further information can also be found in the main entrance to the hospital at the Macmillan Hub. If you are receiving cancer care from another trust, please use the resources listed on the previous slide for additional information. Take care, and bye-bye for now.